As much as Canadians love their healthcare system, anyone who has much direct experience with it knows that lengthy wait times, scarce resources, rising costs, and abuse of the system are a fact of life for Medicare. Can healthcare be delivered more efficiently and at lower costs while preserving the good health of Canadians? As MLI's research has demonstrated time and again, the answer is a resounding yes. Hi, I'm Brian Lee Crowley, Managing Director of the Macdonald-Laurier Institute. Thank you for joining us for this fourth and final installment of our video series on Medicare's midlife crisis. Today we will continue to explore the many ways Canada's health system can perform more efficiently and effectively for the benefit of all Canadians. There will always be those in the healthcare field who agree with the analysis of the Romanow Commission, that there's nothing wrong with Canada's health system that more money won't fix. But believe me, we've tried throwing money at the problem. Record high levels of federal cash were supposed to buy us what Prime Minister Paul Martin called a healthcare fix for a generation. But that same system is now more than a decade older, more expensive than ever, and just as badly in need of reform. Due to a growing population of seniors, Canada faces a fiscal squeeze of declining tax revenues and growing health costs that will force us to change. The issue here is far greater than simply cost. A poorly functioning medical system takes its toll on patients as well. Just ask Dr. Brett Belchetz, an emergency room physician who deals with these issues every day on the front lines of the Canadian healthcare system.
Things like routine diagnostic colonoscopies can be a struggle to get. Things like access to MRIs, CT scans, again, can be a huge struggle to get. As a clinician working on the front lines, when you are not able to get patients access to the correct diagnosis and the correct treatment in a timely manner, certainly that compromises the outcome.
And patients are not helping the situation. According to Dr. Belchetz, Canadians' own behavior adds significantly to the system's costs.
I will see patients who have seen their family doctor for a cold in the emergency room, and they didn't like the diagnosis of cold because they wanted antibiotics. And then the next day, they will see a walk-in clinic again asking for antibiotics. And when they don't get antibiotics from the walk-in clinic, then they come to see me in the emergency room on day 3. And the cumulative cost of those 3 visits is extreme. Just one emergency room visit, some studies have estimated just walking through the door to the emergency room and registering as a patient can cost the system $300 to $400.
Such unjustified demands on our healthcare resources make for a longer wait for the rest of us to get the services we really need. But frankly, it's easy to abuse the system when there is no financial cost to you when you get a healthcare service. Outside Canada, the notion that patients who can afford it should pay a little bit for their care to reduce this kind of abuse isn't at all controversial. Consider how it works in Sweden. According to former Swedish Employment Minister Sven Otto Littorin, the common Canadian notion that user fees will keep people from going to the doctor is complete bunk.
What happens is, of course, that if you're sick, you go to a doctor, and if it's a one-time fee of $15 or something like that, it doesn't prevent you from going to a doctor. It's also the case that if you are without means, you're exempt from paying this fee.
Studies have shown that asking patients to pay a portion of their cost reduced the demand for unnecessary care, but importantly, there was no negative impact on health. But what about those who claim that rare but serious illnesses might go unrecognized because people would skip going to the doctor to save the fee? Littorin says that isn't Sweden's experience and that there are better solutions to this problem than free care.
If you have a million cases, yes, you might miss 1 or 2 within a million cases. Yeah, I agree, you might do that. But the alternative is to waste doctors' times that they should be there treating patients with real problems. Nurses in Sweden, that's my experience at least, are extremely good at making these judgment calls in the first instance. And as soon as they feel that there might be something else, they will refer you to a doctor. But they will take away a lot of the misuse of times when people come in with scraped fingers or runny nose or something. And that is good for the entire system.
In addition to asking Canadians to pay something toward the cost of their health care, we also need to get bureaucrats to stop thinking they can run something as complex as the healthcare system, as Professor Brian Ferguson explains.
The information requirements for the provincial Department of Health to decide how every single medical practice in the province, no matter what province you're looking at, how every single practice in it should be organized, this is impossible to manage. So the more central direction you get of the detail of how medical care is organized and how care is delivered, the less efficient it's going to be.
For a great illustration of the trouble with healthcare delivery, consider how a dentist's practice works compared to a typical doctor's office. The dentist is paid for the service and left to decide how to deliver the care.
If you go to your dentist, there's a pretty good chance that you might see the dentist for a minute or two. But most of the time there, if you don't have any serious problems, you're going to be spending with a dental assistant and a hygienist. If you go to your GP, if they're in a sort of traditional medical practice, most of the time there you're going to spend with your GP. The system has never adapted to the notion that somebody other than the GP could be supplying the services or part of the services within the GP's practice.
So what would a more efficient Canadian healthcare system look like? MLI's research has shown that greater efficiency will not come from bureaucratic command and control. It will only come if we create the right incentives for patients and providers. There should always be some element of out-of-pocket payment for medical care, while exempting the costs of catastrophic health events. In a sensible system, the role of bureaucrats in providing health services could be greatly reduced, allowing competition between hospitals and specialty clinics. That would cut waiting lists and costs. For proof, look no farther than Saskatchewan. MLI has studied the use of private clinics in that province for dozens of different procedures. And in every case, private clinics were less expensive than doing the same procedure in the hospital. So what does a fiscally sound, economically sensible, and compassionate healthcare system look like? It would still prize universal access, but it would use better incentives and rely more on Canadians' good judgment than bureaucratic command and control. The evidence says that would reduce costs while producing better outcomes and focusing the system on the needs of patients rather than those of powerful health professions. If Canadians truly want the best healthcare system in the world, this is the approach that will get us there. Well, that's it for our series on fixing our nation's healthcare system. All the MLI papers mentioned in this series are available on our website, and we'd love to hear your thoughts through whatever medium best suits you. Thanks so much for watching.